Hello, everyone. Good afternoon, and welcome to the webinar, Queer and Transgender Immigrant Health. In California, we're excited to share with you today about enrolling into Medi-Cal, accessing services, and filing complaints. Let's move into our language introduction. Edna?
Thank you, Hector. Hello, everyone. This is Edna Santizo, and I'm going to be interpreting this session along with my colleague, Julie. I'm going to be providing instructions first in Spanish, and then I'll follow in English. Please listen carefully, as everyone will have to choose a language channel when we start interpretation. Hola a todos y todes. Buenas tardes. Soy Edna Santizo y voy a estar interpretando esta sesión junto con mi colega Julie Young. Vamos a dar instrucciones cómo acceder a la interpretación. Por favor, pongan atención porque todos van a necesitar elegir un idioma. En un segundito vamos a iniciar la función de interpretación. Si está en una computadora, en la parte baja de su pantalla va a haber un icono que dice interpretación. Una vez aparezca, por favor presione y seleccione el idioma de su preferencia, ya sea inglés o español, y también mute original audio o silenciar el audio original. Si está en un teléfono o una tableta, hay 3 puntitos o donde dice más. Presione, seleccione el idioma de su preferencia y también Mute Original Audio. Si por cualquier motivo está teniendo problemas técnicos o necesita asistencia, por favor diríjase al personal de Children's Partnership o alguno otro de nuestros colegas a través del chat. So hello everyone. In just a second, we're going to enable the interpretation function. If you're on a computer, you're going to see an icon appear at the bottom of your screen that says interpretation. Once it's there, click and select the language of your preference, either English or Spanish, and also mute original audio. If you're on a mobile device or a tablet, you're going to see 3 dots where it says more. Click there and select language interpretation, then the language of your preference, and also mute original audio. If for any reasons you're having issues with the audio, just let us know and we'll provide technical assistance. Thank you.
Thank you, Edna. Muchas gracias. Let's get started. Alma, next slide.
Yeah, welcome everyone. We're really excited to have y'all and to share all of this great information. A couple of announcements around the webinar. We are recording, so this webinar is being recorded, and this recording, along with the slide deck, will be sent to folks via email. We have a question and answer box within the Zoom settings. So if folks have any questions, please feel free to add any questions or comments within that Zoom Q&A box, and then we'll be answering all of those questions at the end of each section. So we'll be going through different sections, and we'll be answering the questions at the end of each one. There's also availability for closed captioning. So if you click within your Zoom settings for live transcript, the live transcript button within the toolbar, you'll be able to start the closed captioning for the session as well. So there'll be options there that you can select and can turn on so that you're able to follow along through closed captioning as well.
Next slide. We have an equity announcement as well. We are inclusive of all people's perspectives except for hate. So for this webinar, we do not tolerate racist, transphobic, homophobic, xenophobic, misogynistic, malicious comments, and will remove and report anyone who disrupts the growth and peace of the space. Our objective is to create a welcoming and inclusive environment. Next slide. Also on an announcement on terminology. For this webinar and the resource that we're sharing with you, we use the terms queer and transgender and the acronym QT to refer to the larger lesbian, gay, bisexual, transgender, queer, intersex, asexual, two-spirited plus communities. We want to simplify the understanding that we're speaking about sexuality and gender. And so in the simplest form, queer and transgender people exist within an expansive spectrum of sexuality and gender within the human experience. This spectrum exists whether you believe it or not. If you are not straight, you exist within the spectrum of queerness. If you are not cisgender, you exist within the spectrum of transness. Knowing and understanding where you are within the spectrum is your journey. And the purpose of this document, these are the acronyms that we will be discussing using. Next slide. Our agenda for today, as we're moving through introductions, then we'll share a little bit about the queer and transgender immigrant experience to provide some context about who transgender queer immigrant people are. And then we're going to get into our resource, which is the brochure, Queer and Transgender Immigrant Health in California. We've simplified very complicated information in its most simplest form so that you can use it with the people that you love and support. We're going to hear about case studies so we understand this information much more deeply and get to hear examples. We're going to share additional educational resources with you because we have so much that we've developed and want to make sure that you have all the information that you need. We're going to close out with an evaluation, and of course, completed that will enter you into our raffle. Next slide.
Okay, so we're excited to introduce everyone and get y'all to know who our panelists are. So if you can see in the next slide, we have a list of the organizations that help make this webinar possible. The dream team, for sure, being able to work with folks to put together all of these great resources for y'all. So we have the California LGBTQ Health and Human Services Network, which was founded in 2007 and is a statewide coalition of more than 60 nonprofit providers, community centers, clinics, researchers who advocate collectively for state-level policies and resources that help advance queer and trans health. We also have Placencia Consulting, who I am part of the team of, and we're a social justice action firm trusted to transform people, systems, and power. The California PIF Coalition, which is a work group in collaboration with state and national organizers who lead in creating trainings and resources for both service providers and community members to help them expand healthcare access for immigrant communities. And last and certainly not least, the Children's Partnership. And the Children's Partnership is a California advocacy organization that's advancing child health equity through research, policy, and community education. And then in the next slide, you'll be able to see all of our facilitators. My name is Alma Leiva. I'm the head of programs with Placencia Consulting. You've been hearing from my colleague Hector Placencia as well, who's the executive director. Later on in the session, you'll be hearing from Danny Cesena, Emma Dinkelspiel, Oscar Sandoval, and Yarina Asensio. Folks will be talking about all the different aspects of the brochure as well as the case studies and just the different things that Hector mentioned in the agenda. So we're excited to have all these folks here and for them to be able to share all their knowledge with y'all.
So a little bit about the queer and transgender immigrant experience. Next slide, please. In California, it is estimated that there are 59,600 undocumented LGBTQ adults. In the United States, it is estimated 289,700 LGBT identified adult undocumented population, and this is about 3% of undocumented adults in the US. When we're looking at these numbers and their experiences and what they've lived, we want you to understand that this is an intersectional experience as well as an intersectional movement. We have the immigrant rights movement and the queer trans justice movement being able to intersect and being able to support this population. What folks know to live is a socially stigmatized, political, controversial communities. This, of course, has created a necessity to protect ourselves in different ways and create safety. So oftentimes, a lot of our decisions are based on creating safety and wellness for ourselves in different ways and the people that we love. Just as there are parallel challenges within both communities, there are parallel opportunities to be able to protect each other while at the same time elevating our experiences and identities prominently in all spaces. We have a lot of pride within our identity and culture as immigrant people and queer and transgender people. We've learned to take care of each other through community care and are determined to live and challenge power in various ways, which has allowed us to bring this work to manifest. Next slide. As far as the challenges that we experience and want to really center are the political and social environment that are created that impacts the well-being of queer and transgender immigrants. We want to be able to center in this conversation health as being a social determinant of health, policy being a social determinant of health that infiltrates the lives of immigrant people and queer and transgender people, which is so beautiful why this work has developed through the Health for All campaign, because we are specifically addressing systems while we are also healing people as we talk about health. Moving forward, we have a shared responsibility within our community to continue to take care of each other and share resources to navigate the US healthcare system. So that's really the intent with this resource as well, that you can sit down with someone and help them navigate how to enroll and file a complaint. And we will continue to be allies and accomplices to each other, this being a key component that will move forward all of our efforts and systemic structural change, which is at the core of improving queer trans immigrant health. So we do have a few resources that we've shared in the chat. If you'd like to learn more about the power of a healthy California, there's a link to a report that was actually first started in the beginning of the Health for All campaign. And we actually discuss this intersection of queer trans immigrants and their experiences. And this is actually part of a larger 5-part report that informed the Health for All campaign. We also have resources around queer trans immigrants in California. Gracias for sharing those, Aska. Next slide.
Thank you. And just to give a little more context about the queer and trans experience within California, if we really separate out these two populations, we can see that California has the largest populations of both. So there are about 1.85 million undocumented Californians, which makes up about 5% of the California population. The largest amount nationally are residing here in California, but we also have the largest amount of queer and trans Californians as well. So there are over 2.8 million people that identify as queer or trans within the state. So it's really no surprise that California is leading the way in terms of policy change and really bringing forth all of this inclusive policies to help support healthcare access for both of these populations. As we continue to have more folks within the state being able to provide the resources necessary to make sure that folks, that the policies that are getting put into place are being able to be implemented and having buy-in from the community. So if you see below on the graphs, you see that over half of the population identifies as bisexual. And so being able to also realize that we are creating through these different avenues, safer spaces for folks to come out, for folks to feel more comfortable with their sexuality and with their gender. And so as that's happening, again, being able to provide more resources and being able to really know how to navigate these systems and support people through navigating them collectively. Next slide, please. And then just to give an idea too of folks that are both queer and trans, queer or trans, and immigrants, and sharing a bit of like why folks might migrate in the first place. So for some folks, it might be migrating because of their gender and their sexuality. So fleeing because of physical, social, psychological, and or economic violence in their countries of origin. We see about half of trans immigrants are over the age of 50, compared to 13.9% of US born transgender folks. So, you know, depending on where folks live, folks might be having to navigate leaving and coming here to be able to support their livelihoods, right? And transgender immigrants within California, you can see that there are 43.4% that identify as trans women, 26.5% that identify as trans men, and overall 30% that selected transgender as their identity. So folks are definitely present, folks are definitely in need to be included in these different systems and supported in their navigation of the systems within the United States.
And of course, if you'd like to learn more, we invite you to click on the links to all those different reports. We'll share those out with the PowerPoint as well. And now to the exciting piece, the brochure reveal. We're excited to share with you Queer and Transgender Immigrant Health in California. Next slide. Wow. So here's the brochure that we're excited to share, Queer and Transgender Health in California. Now, we know that in order to reach queer and transgender communities, we must make it colorful. We must specifically identify that this is specifically for queer and trans communities. That's what community themselves have shared. So here is the front, loving a community that supports each other and being able to enroll into healthcare. This is the back slide in the middle where it very clearly states immigration status does not matter. And that is the biggest message that we want to spread. Immigration status does not matter. It is based on income. However, immigration status should not be a factor. Here in the bottom, we have a little bit about queer and transgender, stating that we use QT to describe the larger community. So if you'd like to explain that as well and break that, simplify that for whoever you're sharing this with, this QR code leads you to a resource page because we can't fit everything in a brochure. So we want to share a little bit more information with you so that you have all the information you need. And here we have state and federal law and important reminders that we want you to elevate and our partners will go into within the presentation. Next slide, please. Inside of the brochure, what you have here are the main components. One, you're going to want to know eligibility based on income because immigration status does not matter. So based on income, who qualifies? Now that you know if you qualify, what do I do to enroll? A 3-step process. And how to file a complaint, a 3-step process as well. And right at the bottom is all of the Medi-Cal services for affirming care. In various discussion with partners, we've heard that there hasn't been a list that has previously existed. And so we're happy to share this list of comprehensive services that our partners will go in detail about what those are. We invite you to share what available services are under Medi-Cal. And of course, really emphasizing that filing a complaint is a part of the process. We want to ensure that people feel that understand that there's a culture shift that needs to take place, that within filing complaints, that we need to just start being more comfortable around that because it is really the component that's going to oftentimes guarantee the care that is medically necessary. Next slide.
Thank you. And every single component that is within this brochure is expanded on within our resource page. So as Hector mentioned, if you scan the QR code within the brochure, it'll take you to this resource page that's also translated in multiple languages. And that includes an expanded version of everything that's talked about within the brochure. Aside from affirming care, we really want to make this as easy as possible to present. So we have a lot of information in there where folks can see more of what's accessible for them within Medi-Cal, can go a little deeper into how to file this complaint, how to file a complaint if it's necessary, and just generally how to be able to access these services. So this resource page, again, is an expansion of what's within the brochure, just to be able to talk about things a little more in depth. And we invite you to continue to share this with folks as it's necessary. I think one of the things that I'll like re-emphasize of what Hector said is that, especially within the filing complaint part, if it's needed, it's really a way to pave the way to make sure that folks after us are able to get the care that they need in a way that's a lot more facilitated. And so as much as you're able to use the resources within this brochure and within the research page, we would love to support in that.
And just to address some of the comments in the chat, we will be sharing out the brochure with you as well, along with all of the other resources and the link to the chat. Apologies for the blurriness. We wanted to ensure we have both languages available here. Let's go into it.
Awesome. Thank you, Hector and Alma. Good afternoon. My name is Danny Sesenia. Pronouns are he, they. I am the director of the California LGBTQ Health and Human Services Agency, or network, my apologies. I'm going to be going over more about the details of the brochure. And I really wanted to start off, with our front-facing main page, which is that starting January 1st, 2024, immigration status does not matter to get Medi-Cal. I know Hector and Alma went over this, but I just really want to reiterate that it does not matter if you have a visa, or if you're undocumented, or if you're applying for permanent residence. Public charge does not take place here. For those who do not know what public charge is a test that determines if an applicant for a visa or permanent residence in the United States is likely to rely on the government as a primary source of income. However, the U.S. Department of Homeland Security and the U.S. Citizenship and Immigration Services, they do not consider food, housing, and ordinary healthcare services as a part of public charge determination. So this will not affect anybody's status here in the United States. Next slide, please. What does Medi-Cal cover? Undocumented queer and transgender immigrants have the legal right to use many public services here in California. And state and federal laws do protect the privacy of your information. So by utilizing Medi-Cal, you'll be able to visit doctors, obtain medications, vaccines, seek mental health care, substance use care, vision, eye, and glasses care, dental care, long-term care, referrals to specialists, which I'll go into in just a few slides in regards to our gender affirming care, and so much more. So anything that has to do with your access to healthcare, Medi-Cal will cover it. And again, state and federal laws will protect your information and will not be shared with anyone other than yourself and your primary care provider. Next slide, please. So some important things to remember with Medi-Cal is that you do have to renew your Medi-Cal every 12 months to keep your healthcare plan active. The renewal process is extremely easy. Every year you will receive a mailed yellow envelope with the Medi-Cal renewal form. However, this last year, Medi-Cal offices did run out of the yellow envelopes. So some of the renewal notices were sent out in white envelopes. So it's really important to really pay attention to the mail that you're receiving to ensure that you don't accidentally throw it away or dismiss it. but go through all of the documents so that way you do not miss the renewal process. Once you receive your documents, they must be completed by the due date printed on the form. And if you don't complete it, you could lose your Medi-Cal coverage. During the renewal, it's very easy. Again, you're just going to review and update your household information and review and update your income, expenses, and deductions information. Also on this part of the brochure, we mentioned filing a complaint because it can help improve your healthcare and for other queer and trans folks as well. You will not be penalized for filing a complaint. It is free and legally protected, and we will go more to filing a complaint in just a few moments. Next slide, please. So as Hector mentioned earlier, your Medi-Cal eligibility is based off of income. However, you can also get Medi-Cal if you're over the age of 65, if you're blind, disabled, if you're under 21, pregnant, or in a skilled nursing or intermediate care home. Next slide, please. And you can also obtain Medi-Cal if you're on refugee status for a limited time, depending on how long you have been in the United States, or if you are a parent or caretaker relative of an age-eligible youth, or if you have been screened for breast or cervical cancer and need to enter into the breast and cervical cancer treatment program. So income is only one way of obtaining eligibility for Medi-Cal. There are several other ways as well that I just spoke out here, where you can also be eligible to receive healthcare services. Next slide, please. So the enrollment process, just like the renewal process, is fairly easy. Again, other than your proof of income, which you'll need, which is your pay stub or bank statement, you'll need to make sure you have a valid ID. You need to make sure it is not expired. So this could be like your driver's license or state ID, a passport, a school ID, a work badge. Anything that has your name, your legal name, as well as your date of birth. And then you'll also need your proof of address. And this can be like a cell phone bill, a rental agreement, and everything. And you'll take these items and you can enroll in several different ways. You can either enroll over the phone. You can enroll online at benefitscal.com or even through Covered California. Or you can enroll in person at your county's office. After you enroll, you'll just wait for the application notice, and it should not take more than 45 days to determine your eligibility for Medi-Cal. Once you are approved, if approved, you'll sign up for services. So at this point, you will choose your primary care physician and such. But if you happen to be denied, you do have that right to file an appeal. Next slide, please. So what is covered with Medi-Cal services when it comes to gender affirming care? So basically anything that is in WPATH standards, standards of care version 8. This includes hormone replacement therapy, puberty blockers, breast augmentation, double mastectomy with male chest reconstruction, facial feminization, phalloplasty, voice therapy or speech therapy, hair restoration, laser hair removal. Again, anything that's in WPATH version 8, standards of care. So what you see here with this part of the brochure, this is not the full comprehensive list. So anyone can Google WPATH standards of care version 8. And it's a really great document to really know and understand, because that is what insurance agencies use to approve services for our community. So how do we know that Medi-Cal has to cover our transitional care? Well, the Insurance Gender Non-Discrimination Act is codified in our Health and Safety Code, section 1365.5, and it prohibits health plans from discriminating against individuals because of our gender, which includes gender identity and gender expression. Next slide, please. So what happened was that the Department of Managed Healthcare in the state of California gave guidance to the health insurer plans and stated that these insurance agencies are not allowed to deny us medically necessary care because of our gender, gender identity, or gender expression. So hormone replacement therapy, breast augmentation or chest removal, electrolysis, all of these things are considered medically necessity and not cosmetic. For anyone else that is not part of the QD population, it is considered cosmetic. But for our population, because this keeps us alive, because it alleviates our mental health distress, this is considered medically necessary. Next slide, please. So as mentioned, insurance companies will follow WPATH guidelines and what WPATH considers as medically necessary. And this is why it is very important for mental health providers to quote WPATH in their letters. Next slide. So what you're going to see dropped in the chat right now is a sample mental health letter that myself and my team created to provide to you all of what insurance agencies are going to look for when it comes to the mental health letter. So that way it can be flagged as medical necessity. So in this mental health letter, as mentioned, you want to include WPATH references such as the chapter, page, and section. Also in this sample letter, you will see a bunch of highlighted areas where you will want the mental health provider to plug in your clients or the patient's information and exactly what it is that they're looking and flagging for. Once your client does get this letter back from their mental health provider, you want to ensure that your client then takes this letter to their primary care provider and they submit this letter as well as a prior authorization request for the services that your client is seeking. With the Medi-Cal, a prior authorization is called a treatment authorization request or a service authorization request, also known as a TAR or a SAR. So both the prior authorization and the letter must be submitted together to Medi-Cal for that prior authorization. If a prior authorization is submitted without that mental health letter, it will be denied. So really ensuring that you take this a template, and this is just a very loose example templates and everything, that it's completed 100%. All of the areas are filled in correctly. So that way there is less likelihood that the Medi-Cal services will deny the requested service. So really what we want to make sure is that everything you see here on the brochure and then more is covered 100% and is not denied. Next slide, please. And with that, when we go into our file a complaint section, I am going to turn it over to my colleague, Emma.
Thank you so much, Danny. It's so nice to meet you all. My name is Emma Dinkelspiel, and I'm an attorney at Bay Area Legal Aid Health Consumer Center. We're the Bay Area affiliate of the Health Consumer Alliance, and I'm thrilled to be here. What happens when your care is denied, when your health plan violates the law and refuses to provide coverage or provides coverage too late, fails to follow your timely access laws or what have you? There's a simple two-step process. On a sort of a top-level sense, you want to think of it as a two-step process. Step one, you're going to file a complaint or a grievance with your plan, with the health insurance company itself, as soon as possible. And that's true no matter what form of health insurance you have. That's always going to be step one, is you're going to file a complaint directly with the health insurance company, except in case of emergencies, in which case you might be able to skip a step and go straight to the government agency. You file that, different plans have different restrictions on how long you have to file a complaint after a denial of that kind, and you can review your evidence of coverage to figure out what that timing is. But the truth is, the answer is always as quickly as possible. As soon as you decide that as soon as you determine that you've been denied care, you generally just want to pick up the phone and call member services and file that complaint right away. You can then supplement and strengthen the complaint. We have some tips here in terms of making that complaint as strong as possible. Getting a letter of support from your doctor, the way that Danny described, can be really helpful, and it can really make the difference. But if you have a discriminatory plan, having a doctor who is emphatically on your side and makes the strong case that something is medically necessary can change the game. You also want to make sure that you review the information that the plan provides you about what is and is not covered. That's usually called an evidence of coverage. And you can read through that and see, okay, actually this has, I have a deductible of such and such. And the reason my plan's denying me is because I haven't spent through the deductible. That will help you avoid surprises. And it'll also help you determine where the answers you're being given by whoever you're talking to are not true, are not in compliance with the contract. Perhaps you read through the contract and it says, absolutely, we cover gender affirming care. We're an equal opportunity health insurance company. We follow the law. And then you call in and they say, well, we don't cover facial feminization services. It's good to have the evidence of coverage to quote to. You want to keep copies of everything that is sent and everything that you sent. This seems like a gimme, but it's very easy to lose, the 15th letter you've received. Maybe keep everything in a binder or a folder so you have it all with you. And no matter how frustrating or irritating the response that you get, don't throw it away or delete it. Keep a copy so that you can challenge it as strongly as possible. Once you filed a complaint with the agency, they usually have 30 days to respond. Or 72 hours if the matter is urgent. That's the rule for most California regulated plans, but that's just generally the rule across the board for most plans, including other forms of plan. And then if they deny you, you then have the right to escalate it to the overseeing agency. For the majority of plans in California of all types, that's going to be the Department of Managed Healthcare, and we're going to talk a little bit about what that process looks like. You also, for some Medi-Cal plans, that means that you might escalate it to the California Department of Social Services, which oversees the Department of Healthcare Services. You might have a plan with the California Department of Insurance. You might have a plan that's only overseen by the Department of Labor, or you might have a Medicare plan, in which case you're escalating it to Health and Human Services. Which is the appeal route is going to differ on what kind of plan you have, but it's always safest to start by calling the Department of Managed Healthcare, in the sense that they're very good at getting you to the right place to go if you turn out to not be, if you just feel like you're not sure reading through your plan documents. Next slide, please. One powerful tool that you might have on your side are the patients' rights advocates. There is a California Office of Patient Rights through the Disability Rights of California, and we've got the information on the screen here. Disability Rights of California especially provides patient advocates for folks who have perhaps been involuntarily hospitalized. That's one of their specialty areas. We also have the Department of Healthcare Services has various different ombudsmen for different kinds of issues, including accessing mental health care and behavioral health care. Or if you're just having a problem with your Medi-Cal managed care plan, there is a Medi-Cal managed care ombudsman who can be really helpful resolving issues as well. So we encourage you to reach out to your patient advocate, to your ombudsman, not instead of filing a complaint, but in addition to it, because if they are your advocates, they can be very powerful advocates. Next slide. You have the right to receive your care in the language that you speak. That is a succinct summary of a complicated rule, but it is basically true in all cases. Your plans must offer a qualified interpreter to individuals with limited English proficiency when that might be necessary to you. And they must use qualified translators to translate your letters, and it must be provided free of charge, accurately, timely, and protect your privacy and independence. That is again, a quick summary of these rights without getting into the details is that you almost always have the right to oral interpretation, no matter what language you speak, and especially in dealing with your managed care plan. If you speak certain threshold languages, always Spanish, usually Chinese, usually Vietnamese, some other languages as well. You have the right to receive your, for most plans that you might have, you have the right to receive your paperwork in that language as well, especially certain kinds of fixed forms. And if you're not receiving your paperwork in that language, something has gone wrong and you have the right to request it. That is as I said, a quick overview of a complicated legal regime with a lot of different elements, but that is a right protected to you under the Affordable Care Act, under Medi-Cal rules, under the Department of Managed Healthcare, nationally and locally. And definitely always ask for it, because plans deny it as a matter of course for no reason whatsoever, just because they don't want to call an interpreter. Next slide. Plans must also follow the Americans with Disabilities Act and make reasonable changes to policies, practices, and procedures to provide equal access if you have a disability. That means both physically, you must be able to enter facilities operated by your plan. But it also means in terms of when you're filing a complaint, if you need your complaint response in large print, if you need it read out to you over the phone, you are not literate or you have a disability preventing you from reading text, you have the right to have it read out to you. You may have the right to work with a case manager or something along those lines. There are certain accommodations that are very common, others that are less common, but you have the right to have them considered and given to you under the rules of the ADA, of the Americans with Disabilities Act. And again, quite often plans will fail to provide this information, not because they're not required to, but because they don't go out of their way to provide accommodations if not requested. So we always recommend that if you need an accommodation to request it. Next slide, please. I'd like to talk about a couple of different case studies, a couple of different examples of how this, seeking care might play out in practice. So next slide. We're going to start with a question of, that focuses more on access to health insurance. So Mariela is 30 years old. She lives in San Jose. She's on a family visa, and she's looking to adjust her status to permanent resident, but she hasn't got her green card yet. She's got no job, she's got no coverage, she's got no kids, and she needs to receive medical transition services. What can she do? What is her first step to obtain care? I'm going to be looking for answers in the chat just for, I'll give it 30 seconds. Anyone got any guesses? I'm seeing Julio Espinosa says they're over income for Medi-Cal, but Nicolette Alegado says apply for Medi-Cal, and Nicolette has it. Julio, you're reading a little ahead, but you're not wrong in the next stage of the question. But in this stage of the question, Mariela has no job and has no income and is eligible for Medi-Cal. The fact that she has not yet applied to adjust to permanent resident has no bearing on that, right? Medi-Cal doesn't care about her status at all. And so she lives in California. She's a resident of San Jose. She has zero income. Everything else is essentially a decorative question. She can apply for Medi-Cal. She can enroll in Medi-Cal. She should apply for Medi-Cal. She should enroll in Medi-Cal, and she can receive transition services. And because those services don't involve any kind of long-term care, she can do that without any risk of incurring public charge under the current law. It's, she can be confident that this won't affect her immigration status under the current law. And Medi-Cal does cover, as Danny was laying out, virtually all, or should cover virtually all gender affirming care services. So Mariela then obtains a new job. She gets hired, she gets a job, it's paying her $50,000 a year. Remember, she's a single person in a household of one. We now come to Julio's answer, which is now correct. She is now no longer eligible for Medi-Cal. She is over income. So what are her options now? Jason has it. Covered California is what you should be thinking here. Julio, you're totally right. She can apply for Covered California in November during open enrollment. She can also apply right now. When you have a qualifying life event, when something major changes in your life, for example, being no longer eligible for Medi-Cal, you have a short period, usually 60 days, in which you can enroll in Covered California. whether or not you would normally be eligible. Now, what's important to keep in mind is that Covered California does have immigration eligibility restrictions. I believe what I've laid out here, I believe Mariela would be eligible for Covered California just fine, but certain statuses might not be, in which case she might be eligible for Medi-Cal with a share of cost, or she might be eligible for insurance through her employer, or she might be able to purchase insurance on her own. If she does that last, that's a very risky move, and it's very important that she make sure that she go through a qualified insurance broker or somebody she really trusts, perhaps works with a local community group to make sure she's enrolling in an accredited plan that follows local regulatory rules, as opposed to falling into one of the very common local scams. So if you're looking, if you are a service provider and you're looking for people who are particularly vulnerable to signing up for sketchy forms of insurance, it's people who are over income for Medi-Cal but don't have an immigration status eligible to qualify for Covered California. Next slide, please. So our next case study is about June. June gets their healthcare through a Medi-Cal managed care plan. They need PrEP, but they're running into difficulties. They've been told that they need a doctor's note to prove that it's medically necessary, but when they call their doctor says the next available appointment isn't available for another 2 months. What can June do? While people are giving answers to that, I just want to shout out Yadil's very good answer here. Many counties indeed have an additional county health plan that provides additional coverage for people who are not immigration eligible for Covered California, but not income eligible for Medi-Cal. For example, if Mariela, I believe Santa Clara County is one of them. I'm sure San Francisco County is. If Mariela lived in San Francisco County, I'd tell her, go apply for San Francisco, for Healthy San Francisco, and see if you qualify. Laura Lepe and Maya Diaz Villalta have made great suggestions for our friend June. They should indeed, June might be able to obtain PrEP. In fact, June should be able to obtain PrEP over the counter, and many clinics for HIV do just provide it. There are telehealth services that can provide it. These obstacles that were put in June's way are not actually lawful. But on top of that, step one is and always should be file a complaint with your health plan. If you are being delayed access to care, if your primary care physician can't see you for more than 10 business days, if you are being denied something is non-medically necessary, if you feel that you're being restricted, step one, file a complaint with your health plan. And that is also just to, in the interest of time, I'm going to skip ahead just a little bit. If June, my next example is that June is now seeking facial feminization surgery, but their plan is saying that they won't authorize it because it's cosmetic. That is not compliant with the WPATH guidelines, and Medi-Cal is required to follow the WPATH guidelines. Facial feminization surgery is not a cosmetic surgery in the context of gender affirming care, and Medi-Cal is required to cover medically necessary care. So June can file a complaint with their Medi-Cal managed care plan. If that complaint is unsuccessful, they can either file a complaint with the Department of Managed Healthcare within 180 days of their plan's decision, or they can, if they don't have a DMHC plan, if they have the other kind of Medi-Cal plan, they can file a complaint with the California Department of Social Services within 120 days of their plan's decision. Either way, step two, just as we said before, is to take it to the state agency and make sure that they have the chance to weigh in. June can get help from that through us at the Health Consumer Alliance in many instances if they qualify for our services, or through other local community services who should be able to help them out. Next slide. Yeah, that's it from me. Thank you so much.
Right. Thank you all. There's a lot of questions in the chat, so we're going to take a moment to address them, and we'll try to get through as many as we can, but just a disclaimer that we are logging all of the questions that are coming in both through the chat and the Q&A, so anything that doesn't get answered today, we'll be sure to circle back and send out a document with those answers. But with that, I'm going to just kind of take us back to some of the questions we got earlier on. From Dean, and this might have been either to Danny or Hector when you all were presenting, but how can healthcare providers ensure that their services are culturally competent and inclusive for queer and transgender immigrant communities? And actually that might be for all of the panelists.
Yeah, I'm happy to kick it off. Just over a year ago, 2 years ago now, California signed a new law, SB 923, which is the Transgender Inclusive Care Act. And this requires insurance agencies, including Medi-Cal, to provide cultural competency trainings, not only to their entire staff, but also to medical providers. Effective March 1st, 2025, all insurance agencies have to have a TGI button on the homepage of their insurance agency. So Medi-Cal will be one of them that will have a button on their homepage where if we click it, it will provide a list of every trans affirming provider and their staff that's within your network. This is more than just your primary care providers and endocrinologists, and the surgeons, but this will also include like cardiologists, podiatrists, nutritionists, anyone that works in the medical field. They will have the option to opt in and to be a part of that list. So that way we're not trying to figure out who takes my insurance, who's culturally competent and aware, how do I navigate the system? But this will really make it so much easier for us to gain access to care than for us to consistently having to train our own providers on how to care for us. So again, that goes into effect on March 1st, 2025, and the Department of Managed Healthcare has already put out a list of recommendations, including training recommendations for healthcare providers, where healthcare providers do have to pay TGI serving organizations to conduct trainings to their facilities. And then what types of trainings needs to be included in the trainings that they receive. And then the all plan letter for when the listing of medical providers, that all plan letter should be going out within the next month from DMHC to the health insurers and to medical providers. So all of this is already in the works, and we're excited to get it started enrolling. And I don't know if any of my colleagues want to add to that.
Gracias, Danny. I'll also add that, when it comes into the intersection of these two movements, when public charge initially was elevated, they talked about there was an entire initiative from community clinics and community-based organizations to create spaces for immigrants within community clinics, ensuring even through the Health for All campaign, there's been lots of campaigns and educational efforts to ensure that immigrants feel welcomed and a part of institutions. We need similar and paralleled efforts, if not with this resource aligned efforts, to be able to have that similar deliberate intent for queer and transgender communities. Let's create campaigns where we educate our staff. That is something that a lot of advocate efforts are going to create mandatory requirement. And at the same time, those are initiatives that we can be proactive about without that policy, depending on what institution you are, the different levels of power and opportunity that exists within your organization. We invite you to assess what are opportunities to be able to create one, education around who queer and transgender immigrants and communities are, so folks are familiar how to work with them, resources for opportunities within the services that you do provide for them to be able to receive care. Also being able to identify people within your organization that maybe can be referred to be able to lead these efforts. Lots of great ideas, and with the initiative and efforts of people here to be allies and accomplices, we could really elevate all of this work.
Okay, Carolina had a question early on regarding the fact that immigrant status thankfully does not matter when it comes to Medi-Cal. And a follow-up on that, does that include those on a tourist visa and that are only here as visitors?
Thank you. I'd like to answer that one if it's okay. For a pure question of, would a tourist visa qualify you for Medi-Cal eligibility? The answer is yes, right? Like immigration status has no effect on your Medi-Cal eligibility. For a tourist visa, the answer is a little bit more complicated though, because you are required to be a resident of California to enroll in Medi-Cal. And so if you are on a tourist visa, you're usually representing to the federal government, I am not a resident of California, I am here as a tourist. And so enrolling in Medi-Cal would be representing to a different branch of the government, actually, no, I am living here. Depending on the terms of your visa, that can be an issue. This, that's a very general remark because I'm not an immigration attorney and I don't, but the issue is on the immigration end rather than on the Medi-Cal end. Your status is not relevant for Medi-Cal.
Thank you. And then the next question was a yes or no one. Will we be able to order some of the brochures for our agencies?
We're actually sharing the resource and the link. We aren't providing printing services for the resource itself.
Thank you, Hector. Question from Jennifer, and starting off with a comment. I'm already impressed by your dedication to serving our communities. Thank you. Do you have a list of vetted providers by region that we can confidently recommend to our immigrant LGBTQ clients?
We do not have a list. However, I do know that various LGBTQ organizations across the state have been building relationships with medical providers and finding out what types of insurances that they accept. So my recommendation would be to contact your local LGBTQ center and see if they have a medical provider directory that they would like to share with you all. So just from my own experience, I don't know if my colleagues have something else.
I'm seeing a nod from Hector, so I think we're in agreement here. And the next question is from Juan Carlos. The undocumented community are scared to complaints. Does it still count if the complaint is sent anonymously?
I'm going to speak to this, but I think we probably each have slightly different angles on this. When you're talking about the kind of complaint that we've been discussing here, where you're making a complaint with the health plan to try to challenge a decision that they're making on your care, there's no way to make those complaints anonymously. Or rather, you could make an anonymous complaint and it might help build a body of evidence against the plan down the line, but it won't affect your particular case because in order to get a remedy in your particular case, you have to identify the case. That is, I very much understand the concern that you're describing. If somebody is already a member of a health plan, there's very little that you would ever provide in a health plan complaint that wouldn't be information they already have. It's very rare that any information you provide in a complaint is anything the health plan doesn't know. You're just laying it out from them in a different way. There definitely are exceptions, and it's always good to be cautious, but it is a relatively low risk kind of complaint.
Part of, sorry, Yadi. I'd also add that that's part of the culture shift that we do want to really elevate and emphasize within our queer and trans immigrant communities. We know that the fear exists, and since a community is looking to you as a resource to be able to guide and lead them, being able to have this understanding be implied, be a part of common sense, be a part of the process, that's where we really are looking to get our community to be able to reach. As I know Emma has consistently shared that there is no retaliation for being able to file a complaint, elevating that there's a safety in being able to file a complaint and you being protected. and to walk with them as much as possible because we know that it is a difficult thing to do to engage with systems.
Excellent reminder. The next question is from Bliss. For those who inject hormones, do they also cover the cost of needles? And I think this is regarding Medi-Cal.
Yes. So when it comes to injecting hormones, they do cover the cost of needles. My strong recommendation would be that when your provider puts in a prior authorization request for your hormones, for it to also include your needles and syringes. So that way those are covered as well. Many providers will forget to put in for needles and syringes, and you'll just need to make sure that they put in for all three.
I just want to add, sometimes there's some ambiguity about whether or not needles are covered under your plan or under Medi-Cal RX, which is the Medi-Cal prescription plan, prescription division. I'm honestly, I am blanking on which one it ended up sorting out that they were covered, but it should, you know, at worst, you might have to make 2 phone calls rather than 1.
Thank you for flagging that, Emma. And this next one might be for you, actually. Dean wants, what are the steps involved in filing a complaint with Medi-Cal if a queer or transgender immigrant experiences discrimination or inadequate care? And what protections are in place to ensure their concerns are addressed fairly?
I can speak to that. So for discrimination complaints, Medi-Cal has its own various different, as mentioned, various different patient advocates, various different ombudsmen. That's often a good way to elevate complaints about discrimination or quality of care, where you're not looking for an immediate outcome, but you simply want to report the ongoing issue. You can also file a complaint with the Civil Rights Division, which is a completely separate agency in the state of California, empowered to investigate reports of discrimination by any kind of state agency or state provider. That would definitely include all Medi-Cal managed care plans. It would include most doctors, anyone who provides public services, right? It's unlawful to retaliate against somebody for filing a complaint of that kind. The procedures that are put in place to prevent that from happening tend to be, you know, the ability to continue to escalate to file additional complaints if retaliation should take place. In the majority of cases, we don't tend to see retaliation for most people who file complaints for the simple reason that these agencies are very large and very bureaucratic. And so they just don't notice. You know, people aren't usually flagged in that way because it like these entities are too big to pay attention to individual complainants in that way, to target them in a very different way than if you're complaining to the, you know, if a nurse treats you badly at a doctor's office and you complain to the doctor, the nurse is going to remember you, right? Like, that's a small office. It's very different when you're complaining about a particular social worker in a county that employs 200 people or 1,000 people. It's so that is the practical, not a guarantee, but the practical reality is that we see those very rarely. Of course, that changes when you are one of the unfortunate but very real people who have to file quite a number of complaints when you have in those situations, the law is on your side. It is completely unlawful to retaliate against somebody for filing a complaint of that kind, and you may have, you know, additional causes of action based on that. And it is always illegal to discriminate, not just based on language and not just based on race, but also based on immigration status as well.
Thank you. We have about 5 minutes left, so I know we won't get through all the questions, but going to try to get a couple more before we move on. And as I mentioned, we'll be revisiting all of the ones that were posed today that we didn't get to, and circling back with what we did respond to live as well. A question from Silvano: how can a person apply, I think, to Medi-Cal if they obtain their income in cash and they don't have any proof of that income?
I'll just repeat my answer in English and forgive me for any Spanish mistakes I made. Medi-Cal is required to accept written declarations or even orally given sworn declarations for most cases. So if you can't provide proof of income, you can usually swear under penalty of perjury. Just remember, anything you report to the government is something you're reporting to the government. So you're required to report it to apply for Medi-Cal, but you are then reporting it to the government.
Thank you, Emma. And then the next question is, what specific healthcare services and treatments are covered by Medi-Cal that are particularly beneficial for queer and transgender immigrants, such as gender affirming surgeries, hormone therapy, and mental health support? And we might have a slide speaking to this if we want to circle back to that.
Yeah, we did have a slide speaking to this. All of these things are covered. And as mentioned earlier, the insurance agencies really rely on WPATH Standards of Care 8. Is WPATH perfect? Absolutely not. But my strong recommendation is to really familiarize yourself with WPATH Standards of Care 8. And again, just really cite, the chapter, the page number, etc. If you don't have access to the Standards of Care 8, I'm adding it in chat. That is the full document. And then if folks need it in other languages, here is another link with all of the other languages of WPATH. So that way you can see exactly what is medically necessary and you know how to write it in your letters or how to best guide your patients and clients.
Thank you, Danny. Maya, from what I understand, letters are not a necessary or advised first step for contacting your primary care provider because letters can expire and they may need to be redone by the time a surgery, etc., is happening. The question is this different for undocumented folks? What is the reasoning behind this recommendation? Sorry, I'm not sure what the recommendation that was pertaining to, but hopefully panelists recall.
Yes. So I think there might be some confusion here in regards to the letter. When a mental health provider provides a letter, let's say for someone who wants to start hormones or wants to have a specific surgery, from the day that the letter is dated, the client has 1 year to turn it in to their medical provider to get their prior authorization. So that way they can see either the surgeon or endocrinologist to get the procedure that they want. It's not that it expires before their surgery or anything. It expires 1 year for them to turn it in to get that prior authorization. With Medi-Cal, you cannot see any specialist or surgeon without turning in that letter to your PCP and getting that prior authorization. And it doesn't matter if you're undocumented or a citizen of the United States. It's the same for everyone. The process is exactly the same and everything. You have to get that letter, you turn it in, get the prior authorization, and then you're referred to the specialist. So it's not, by the time of surgery or anything, it's to start the process of everything, and they will not need another letter to start hormones or to if they're getting a letter for their let's say top surgery, they don't have to get one letter for their PCP and then another one for their surgeon. That one letter covers everything or the whole process for that top surgery.
Thank you, Danny. In the interest of time, I'm gonna wrap up our Q&A right here. But I just want to thank everyone for the very active engagement. And what we'll do now is proceed and share some additional resources that might be of interest to folks. And again, we'll also, after today's session, circle back with some of those questions that didn't get answered. But feel free to keep them coming throughout our session today. All right, and I believe our next speaker is Liz. Hi, Liz.
Hi, and hi, folks. I'm so happy to have all our great presenters today, and thank you for joining us. So wanted to share some of the resources that we've created through the California Protecting Immigrant Families work group. This is a work group really focused on outreach and communications and making sure that communities understand how to access care once policy changes occur. So we've created a few handouts with the help of Hector. And so these handouts, the first is the APCs of Immigrant Health. I will note that there's translations in other languages that haven't been updated to reflect the expansion for Health for All, but English and Spanish has been updated. And then we have other resources on CPCA's immigration resource page where you could find recording trainings, service provider modules that you could use to talk about access for different populations like children, ag workers, and then also have more kind of ample information if you're looking at doing a media campaign or anything like that. So that's all discoverable on cpca.org/immigration. Next slide. And then if you are one that loves to do QR codes, please scan. This will lead you to kind of our resource hub. If you do the CPCA website, it'll lead you to the California PIF site, which has all the resources. And then there's also a Google folder, just another way to access kind of similar information. But if you want the recordings for trainings in that I think would live only on the CPCA website. Next slide, thank you. And these are just examples of the APC immigrant. Like I said, there's some translation needs to happen for these to just reflect the Medi-Cal expansion, but I believe the rest still remains true and accurate. Next slide. And then these are additional resources just to remind folks. CDSS, for example, has a public charge provider list of attorneys, if that's something that you're interested in. And then pro bono legal services, there's another list for you as well. And then, of course, Keep Your Benefits website, which helps do an assessment when a patient is coming in or looking to get into Medi-Cal and trying to decipher whether or not public charge is something that they should be concerned about. So this is a great way to do a quick assessment with them that would then tell them whether or not they need a concern about public charge given their current status. And it also tells you, if it's saying refer to a attorney, it tells you kind of where to go for those referrals. All right. And so with that, I'll hand it over to Oscar from TCP to share out the resources that they've created.
Thank you, Liz. So I'm here to present on 3 new fact sheets that TCP co-created with members of the California PIP Coalition that are actually here in attendance, as well as members of our Whole Child Equity Partnership Coalition. Our first is a health coverage fact sheet on the left. This is a front and back sheet that essentially walks families through each step of the process of checking your eligibility, applying for Medi-Cal, enrolling, accessing care, and then renewals. So it's got a nice little roadmap on the front, and on the back, it goes into much more in-depth. It just provides a lot more detail for each one of those steps. Our middle fact sheet is our immigrant health coverage fact sheet. This one specifically spotlights the Medi-Cal expansion. As Danny mentioned earlier in the presentation, starting January 1st, all undocumented all Californians, regardless of documentation status or age, are eligible for Medi-Cal as long as they meet income eligibility. So this is just a fact sheet highlighting that policy change, as well as giving some of the early steps on how to begin the application process and enrollment process. Our third is a public charge roadmap fact sheet. As has been alluded to in this webinar multiple times, there are many folks that are afraid or concerned about accessing public services because of the documentation status. And this is meant to just break down some of the myths and some of the fictions that are currently out there around these issues. So it gives a pretty comprehensive list of what public services do and don't count towards public charge, and who public charge even pertains to in the first place. And then go to our next sheet, please. Thank you. So if you are interested in downloading any of these fact sheets, I have a QR code that's up on the screen. This will take you to a link where you can download all of these fact sheets, including we also have an educator toolkit that has these fact sheets, social media templates, and it's specifically meant for health and education educators to share resources around enrollment, renewals, public charge with their communities. All of these resources that y'all saw are available in English, Spanish, Punjabi, Tagalog, traditional Chinese, Vietnamese, Haitian Creole, and Korean. Yeah, so please feel free to scan examples of, and also drop links to the chat too on the next slide. And some of the, besides community facing resources, we also have resources for policymakers, CBO leaders. One example is our Child is a Child fact sheets. So this is part of our Child is a Child campaign. It's a series of fact sheets that focuses on the factors that contribute to disparate health outcomes for LGBTQ+, Latine, Black, Asian American, Pacific Islander, and children from other marginalized communities. The one y'all seeing here is for the queer and transgender youth. But again, we have these for a variety of communities. And then let me drop the links really quickly to both of those in the chat so you all have them. But again, our All In for Health website, which is where we store a lot of these fact sheets, also has a bevy of information, help families find local enrollers and navigators, just FAQs around enrollment, public charge, and other issues. So we invite you to explore that as well. Click one more, Monique. Awesome. So we are incredibly grateful for everyone that was able to join us today. We've had a huge turnout, and we're just so happy that folks have been able to not just come and listen, but if y'all could see the Q&A in the chat, people have been inundating us with resources too. So we love that this has become a communal space. There's no expert here in the room. We're all experts of our own life experiences, and we are just indebted that y'all chose to join us today. With that, we'd love to hear your feedback. We know we could always do a little bit better. I'm going to drop a link in the chat right now to our survey. And for folks who are who submit the survey, you'll be entered into a raffle. We'll be raffling 4 $50 gift cards. We won't be doing it today. Some folks were asking if it was live, but we'll be doing it after the session. And then someone from our team will be reaching out to y'all to let you know if you won or not. So the link is now in the chat. If you have any issues accessing it, please feel free to leave a comment. And other than that, I think we keep moving forward. And I'll kick it back to you, Hector.
Thank you, everyone. So grateful for all of your insight and your expertise, both our participants and our panelists. So part of next steps is, as you're looking at that survey, yes, please complete it so you're entered into the raffle. Also, just to give us any feedback that you think it's important for us to note. We are going to be compiling a lot of the information that you shared and then we shared out as well in a follow-up email where you will receive the recording along with the brochures, the links to the resource, all of these resource pages that we've shared out. And we'll also do our best to answer all of the questions that you posed if we weren't able to answer it here directly. Here in the screen, you'll see your facilitators for today. If you'd like to continue to be in contact and reach out, here are our emails and then a phone number for Emma's legal team to be able to support any participant, any clients or folks that you work with. Next slide. And with that, we close out today. Again, thank you and for continuing to support queer and trans immigrants in California. Bye, everyone.